To my channel. I'm Dr. Jokshi and welcome. What is insulin resistance? Insulin resistance occurs when the cells in your body fail to appropriately respond to the insulin produced naturally or when it's administered through medications. This inefficiency in insulin utilization leads to elevated blood sugar levels. While commonly associated with type 2 or gestational diabetes, insulin resistance can manifest in individuals with type 1 diabetes or in relation to other forms of diabetes. It can also be present in those at risk of type 2 diabetes, regardless of age. Now, insulin resistance may be diagnosed either alongside diabetes or as a precursor to type 2 or gestational diabetes. So it's crucial to understand what is insulin sensitivity. Insulin sensitivity, often as mentioned by healthcare professionals, is synonymous with insulin resistance. This phenomena actually indicates that your body requires more insulin because it is less responsive to its effects. So for certain individuals, dealing with insulin resistance and using insulin, higher doses are needed to actually manage the same amount of carbohydrate intake. For instance, carbohydrate ratio of 1 unit to 10 gram carbs equals higher sensitivity. 1 unit to 5 gram carbs equals insulin resistant or lower sensitivity. So what are the causes of insulin resistance? Insulin resistance is more likely if excessive fat is stored in and around the liver and pancreas. While commonly associated with overweight or obesity, it can affect individuals of a healthy weight or with a normal BMI, which is the body mass index. The exact cause of insulin resistance varies among individuals and is not yet fully understood. Factors like hormonal changes during pregnancy or puberty, as well as the type and amount of exercise, can influence how the body produces, uses, or responds to insulin over time. So one might think, how can I know when I have insulin resistance, or what will be the symptoms of insulin resistance? For individuals with diabetes, increasing blood sugar levels or HbA1c, which is the blood marker, may indicate ineffective insulin function. Those at risk of type 2 or gestational diabetes should be vigilant for signs and symptoms, as they could signal or point towards insulin inefficiency. So what could be the common indicators? These include excess fat around the liver and pancreas. It also includes elevated triglycerides or cholesterol and living with overweight or obesity. So one might think, is there any treatment for insulin resistance? So in order to treat insulin resistance effectively, one of the foremost strategies is weight loss, particularly for those who are overweight or are suffering with obesity. This can be a beneficial approach to enhance insulin utilization in various types of diabetes. Additionally, increasing one's physical activity levels may contribute to improved insulin function. Some individuals with type 2 diabetes may achieve diabetes remission through adequate weight loss. Ongoing research trials, such as the Retune trial, suggest that individuals with lower body weights and type 2 diabetes may also achieve diabetes remission through weight loss. And for those managing diabetes with insulin, such as using exogenous insulin in the form of injections, um, it is known that with this treatment, insulin resistance can be present, and it does not necessarily mean resistance to a specific brand or type of insulin. However, higher doses of insulin could be required to cover the same amount of carbohydrate intake. To enhance the insulin effectiveness, healthcare professionals may recommend additional medications such as metformin, which is quite commonly used in type 2 diabetes. And this can be prescribed to reduce insulin resistance in both type 1 and type 2 diabetes. Remember to subscribe for more videos. If you have any questions, leave them in the comment box and I shall reply to them.